meet you. My name's Rachel. I'm going to be the dental hygienist that we were speaking earlier. Yes. Remember? Okay, awesome. I'm here to do your cleaning. Is that okay? Fantastic. This is a cute little place that you have. So adorable. And out here in the mountains too. So wonderful. Okay, so I have my things here. Did you want me to go ahead and help you transfer out of your wheelchair and into my dental chair, or did you want to use your wheelchair? You prefer the dental chair? Okay, no problem. I'll go ahead and get it set up, okay? We have a little setup here. Is it okay if I use your electrical outlet? Yeah? Okay, thank you. I'm just going to set up here. Thank you so much for welcoming me into your home. It's beautiful. I love this area. It's so pretty. So you have a lot of trees around here. It's gorgeous. So I'm going to see what's in my setup. Just some things like gauze, and you've got prophy paste, gauze, and polishers, fluoride varnish, things like that. Move you over into the chair. Just a moment. And it has a little pillow on here, if you noticed. Okay. And with this chair, it's great because this one goes backwards. I'll kind of show you a little bit of how it works. So with this one, it just comes right back like that. And it has the very end of it kind of lift up. So this is a zero gravity chair. Super, super comfortable. Most comfortable chair ever. Much better than actually some of those dental chairs they have. And then it locks in place wherever we are. So that way you'll always be comfortable. And make sure you're not sliding out anywhere. If you don't mind, I'm gonna just put this up here really quick. We have all of our instruments here. I'm going to set up this table here really quick. So I'll have all of our things here. All right, and then when you're ready, we can go ahead and get your caregiver and then help you transfer in, okay? All right, this is our setup here. So we have our instruments, our handpiece polisher. This is the suction that we're going to be attaching to our suction unit. And then we have our water, fresh water, and then the little syringe that I'll use to suction and clean out everything. Okay? And we also have our blood pressure machine that we're going to be taking your blood pressure in a moment. Okay? Let's go ahead and bring you back now, okay? Okay, I'll start leaning you back in the chair. Okay, is that all right? No? Okay, I'm gonna go ahead and get my gloves on, all right? And we're going to start with your blood pressure first. Okay, I'm going to go ahead and check your for pressure. Okay, nice and snug. And just make sure it's a little tighter. Okay, there we go. Go ahead and turn it on. So at this point, I don't want you to talk or say anything. You're just going to relax, okay? And then I'll take just a minute. I'll just a little squeeze. It's not too bad. It doesn't last for too long. You're doing great. Just a little bit longer. It'll release in a minute. All right. Oh, looking good. It's like 110 over 62. That's fantastic. Thank you so much for letting me do that. I'm going to go ahead and open up my kit over here, and we're going to start looking inside the mouth, okay? Little indicator means that it's nice and clean. Okay, we have steam that went in there, and this has been thoroughly sterilized in my office. Okay, I'm gonna get some floss. Suction on. Okay, dear. I'm going to go ahead and take a look around inside the mouth, okay? I'm just going to go ahead and pull back your lips a little bit, okay? I'm just going to be making notes. Okay, we've got one tooth over here on the upper right. Looks like we have a little bit of a stick over here. Okay, and then we've got a couple teeth over here. Okay, and then I'll check the bottom. Okay, then in the front. Okay, so I do see a couple little sticky areas on the upper right, the upper left, one on the lower left. Okay, so those areas I can go ahead and put some medication on today that's going to help prevent it from getting worse. It's called silver diamond fluoride. Yeah, we can place that on today when we're done with our cleaning, okay? Yeah? Okay, perfect. We're going to take some measurements, okay? This is going to be going right between the tooth and the gum. And we're taking measurements here. So there's a 1 up to 12 millimeter ratings. We want 1 to 3 millimeters, okay? Anything above that means that there's some inflammation. 3, 2, 3, 3, 3, 4, 4, 3, 5. Okay, a little deeper there. Okay. Then we're going to move to the other side. 4, 4, 5, 5, 4, 5, 5, 5, 5. And on the inside, 5, 4, 5, 4, 4, 3, 3, 2, 3. Next side, 4, 3, 4, 4, 3, 4, 4, 4, 4. Okay. So we do have some areas of inflammation that we are going to probably have to get down on the top. I'm going to check the bottom. You doing okay? Okay, great. 3, 2, 3, 3, 3, 3, 3, 2, 3. Okay. And skip to the other side. 4, 3, 4, 3, 3, 4, 4, 3, 4. Okay. Then on the inside here, 4, 3, 4, 4, 2, 3, 3, 2, 3. Okay. And on the side, 3, 3, 3, 3, 2, 3, 3, 3, 3. Okay. Lower right hand side looks pretty good. It's the lower left side and then the ones in the top. And do you have a partial that you wear on both top and bottom? Yes? Okay, I can get that clean for you too. Sure. I'll go ahead and take it for you, okay? It's right over here. Okay, I'll grab it. I'll put my ultrasonic cleaner. Okay, so I put that in the cleaner, so that's going to get all nice and clean. Do you feel that your partial is fitting on both top and bottom well? Yeah, and you're able to eat okay? Yeah? Okay. Well, I'm glad to hear that. If it does feel like it's rocking a little bit in the front, because usually when we have dentures, when they're in the front like that, sometimes they can kind of rock a little bit. So as long as the partial is being held together really well by the clasp, it should be fine. We do have a lot of pressure that we put on those back teeth. So we just want to make sure that they're clean and that you're taking really good care of them. Because over time, that can lead to bone loss if the gums get inflamed like they are right now. They continue that inflammation, then over time it can lead to bone loss, and then we won't have much room for your partial. We won't have any teeth left to kind of hook onto your partial. So, and then you would have to get dentures. So we don't want to go down that road. Let's go ahead and try to keep it as clean as we can, keeping it with regular hygiene visits. I'll come in and see you here in your home, since that seems to be more comfortable for you. Yeah, it's really hard to get out to a dental office, right? Yeah. So I'll go ahead and keep coming seeing you every 3 months. We're going to go ahead and do a bit of a deeper cleaning today. So I have some medication that I can use to help numb the gums a little bit, and then we'll go in there and clean out everything. And then we'll check again in 3 months to see how things are looking. Okay? And we'll go over oral hygiene instructions at the end. Okay. So I'm going to go ahead and put some medication around those areas. And this is going to help the gums to heal up nicely. Good. Bottom here. And I'll give you a good section in just a second. Okay, great. Section you out. Go ahead and do some hand scaling, all right? I'm so glad that you called me out here today. Yeah, definitely needed to get a really good cleaning for you. It's been a while. Yeah. Yeah, I figured it's been a little bit. It's okay. No judgment here. I know how difficult it must be to get into a dental office when you are in a wheelchair. Totally understand. Okay, let's have a little bit of gauze here. Just going to clean off blood that we got. Yeah, we got some bleeding back there, of course. Okay, good. Then on to the left-hand side. Okay. This is what I do so that I can make sure that people get the cleanings that they need and they get treatment that they need. If you need to have a little bit more than what I can offer, then I have several great dentists that come into your home. Yeah, I have a few. Okay, let me give you another gauze around there again. Okay, clean that off. Okay, good. Doing okay? Want a little bit of a rinse? Sure. And then we'll go ahead and work on this upper right hand side. Great. Yes. Oh yeah, you have some other friends? You have other friends in the area? That's great. Oh, good. I'm glad that you are able to kind of get out and get into the community. It's really, really good. It's important to stay part of your community, part of your friends. Does your family come visit too? Yeah. Well, I'm glad that they come to you. So, okay. Let me do the other side here. You are doing fantastic. Super easy. Okay, I'm just doing the lower right. Okay. Okay, good. Go ahead and clean off those areas. Perfect. So I'm going to come back in and check on you in 3 months to see if this has kind of gotten rid of that inflammation and infection. And if things haven't improved, we'll probably do an actual deep cleaning. This is more of like a let's clean out everything really nicely because it's been a little while since your last visit. And then we'll check in next time. Okay, so 3 months, I don't want to go longer than that, and we'll see how the gums are responding with you cleaning the way that I'm going to show you in a little bit, and just making sure that you're keeping up with the flossing, brushing. That is extremely important. Okay. And we're going to go ahead and brush here, do the polish. This one is mint. Hopefully you like mint, okay? Yeah. Doing good. Almost done. Make sure we get these biting surfaces really well. Okay, go ahead and do this section again. Okay. Looks like we got a bit of the dry mouth there. It's pretty normal with all the medications that you're taking. I noticed that you take some high blood pressure medications. Yeah, so, which was great. Your blood pressure is so good because Your medication is working really well. That's fantastic. Sometimes there's medication that causes dry mouth, and the dry mouth is not really good for your mouth, obviously. You like to have lots of saliva in there. Saliva is going to help ensure that we aren't going to be getting a lot of acid in the mouth, because the acid is what causes the cavities. So I'm going to go ahead and give you a good rinse. I'm going to go ahead and floss for you. Okay. I know you do have some spacing between the teeth. What I really recommend is Proxy brush. Proxy brushes are fantastic. Anything that's like an interdental brush, when you have big spaces like that, then you know food likes to get trapped in there. You've probably noticed. Yeah. So definitely want to make sure that we're cleaning that out. I'm just going to go through and kind of wipe everything off really well. Okay, great. Okay, we're going to go ahead and do the SDF treatment. So that's literally just a piece of liquid. We're just going to dry off the area. Okay, there's a few spots. So let me go ahead and place this in. Okay, and this SDF, the silver diamine fluoride, it's a little stronger than your usual fluoride. Go ahead and place another spot over here too. Okay, we just want to keep your mouth open. And what it's doing is just penetrating these areas. Get another piece of gauze here. Okay, I got two pieces here. This one's on the bottom. So it goes ahead and it penetrates these areas where the softness is starting, which could potentially be a cavity. We'll have to take a look at your next visit and see if these areas have gotten any harder. If they haven't, then I'll go ahead and refer you to a dentist. And next time we'll take x-rays, okay? Is that all right? Okay, so just those areas. Just gonna wait. Give it about a minute. I'll have you keep open just the way that you are. I'm gonna do the suction. Silver in here is going to help to kill the bacteria, and the fluoride is a very strong fluoride. This one's about 35% fluoride, which most prescription ones are about 1.1%, so this is extremely strong, and that's going to harden that tooth surface. I'm going to go ahead and take out those areas. I'm just going to wipe off a little bit, a little excess. We'll start here on this side. Okay, and then go to the other side. And on the bottom. Okay, so before we finish, I'm going to go ahead and put some fluoride on, some actual fluoride varnish. So this is the stuff that's about 5% fluoride. And so we're going to help to prevent cavities that way. Okay, so I've got some fluoride here on the back of my hand. I'm just going to go ahead and place that on these areas, and you're just going to wait to have anything sticky, hard, or crunchy for the next 4 hours. Then you're going to be able to go back to your normal routine after that. After 4 hours, you do want to go ahead and brush to make sure that you're brushing all this stuff off before you eat. Okay? I know it gets a little sticky, sorry. Quick little section, make sure it's all clean. Okay, and that is it. Okay, I'm gonna go ahead and start sitting you up, all right? Okay, thank you so much for having me on your home today. I appreciate it. I wanted to go over some oral hygiene instructions really quick with you. So you do want to be making sure that you're brushing every day. Use a soft bristle toothbrush. I gave you one in your goodie bag today. And you want to make sure that you're brushing at a 45-degree angle. So we're brushing the back teeth, making sure that we're not using a super tight grip. You want to use a bit of a pen grasp to get back there and to clean. Okay, with that bristles at a 45-degree angle. All right. And you want to make sure that you're brushing for a thorough 2 minutes. When you're using a manual toothbrush and you have a few teeth, you still need to make sure that you're brushing really well. So we need to make sure that we're getting those back areas for a thorough 2 minutes to thoroughly clean everything off. And you're going up to the gum line. So when you're brushing, you're using soft motions and you're not doing horizontal scrub. Okay, just little soft motions like that to kind of clean everywhere. So the front, the inside, the bottom, and the biting surfaces. Make sure we get all surfaces there. And then I also gave you a goodie bag in your bag with a Proxa brush. So the Proxa brush we can use in between the teeth. So it has the instructions on there how to use it. So you're going to be just placing it right in between your teeth. Normally you get it wet with some water or warm salt water. I personally recommend a particular type of product that's called rinse, and it's like an iodine rinse. Perfectly safe for everyone, even if you have shellfish allergies. It's not the same type. This is a molecular iodine, so it's different than the regular types of iodine that you're probably used to, like povidone iodine and things like that. This one does not have any allergies to it. So you can use this one safely. All you do is just put a little tiny bit of that rinse into a cup. Then you're going to take your little Proxa brush, dip it in there really well, and then use it in between the teeth. It will do a couple things. It's going to soften the Proxa brush, and it's going to make it so that you're getting these molecular rinse into the mouth, and that's going to help kill viruses as well as bacteria. So, and it kills different types of bacteria, the type of bacteria that causes inflammation and bleeding gums, and it also helps to kill the bacteria that causes the cavities. So it's a dual fold. This one is fantastic rinse. I highly recommend that you use it. If you can, rinse and spit with it as well. That would also work really great too. Okay? And then after you're done using it, you don't want to have anything to eat or drink for probably about a half an hour. If you can, just to let it sit in there for a little bit, let the medication work. It would be really great if you got one that has the fluoride in it. There's different ones on the market, but there's one with fluoride in it, and that will help prevent more cavities as well. So it was great to meet you today. I will put it on the books to see you again in 3 months. Okay? Thank you so much. Take care.